Okay, wonderful students. This is the chapter on diagnoses, the second step in the nursing process, or ADPI. When you are first learning about nursing diagnoses and how to write them, it's going to feel like you are learning a foreign language. So what I'm going to say to you is this: please give yourself grace and time and be persistent and plug away at it, because we're going to do this with every single patient every single day. But by the time we are done with all the exercises, the practice we're going to be doing in class, it will get much easier for you and you're going to feel better about grasping the concept. So again, remember what I said about MCC being one of the top schools in the nation? Trust the process. Please trust the process. Here are the learning objectives for this chapter. Please take a moment to review each one of these. And again, remember to look at your terms at the beginning of the chapter and the NCLEX questions at the end of the chapter with the rationales. Reading the rationales, by the way, is as important as the question themselves. So why do we do nursing diagnoses? We need to identify the patient's health problems, to plan and implement interventions to prevent or resolve illness, or to help promote coping with their illnesses, right? We also look at the patient's strengths and capitalize on that and incorporate those strengths in the plan of care, right? So the patient being part of the plan of care is a huge component. After assessment comes diagnosing. Now, we do not do medical diagnoses for the patient, but instead we look at the whole patient and their response to the medical conditions that they've been diagnosed, as well as their comorbidities, and how do they affect every aspect of that patient's life, right? What does it put them at risk for, right? Are they weaker because they had a cerebral vascular accident? That's the medical diagnoses. But the nursing diagnoses would be risk for falls or risk for aspiration, right? Because they are weaker on, if they have a right-sided stroke, they're weaker on the left side, and therefore you need to be aware of that and the extent of that weakness, including swallowing difficulties, right? So again, the purpose of the nursing diagnoses is to clarify the exact nature of the existing problem and any risks, as well as how we can focus on our piece, the nursing diagnosis, so that that can be coupled with the medical diagnoses. And guess what? We have greater, more outstanding patient outcomes, which of course is what we're shooting for, right? Get healthier quicker, and no offense, but go get out of the hospital and don't come back and see us. We love you, you're great, but please stay healthy. We don't want to see you again, right? Those kinds of things. So the conclusions you make during this phase can really affect the entire plan of care for that patient. So it's very, very important that you take the time and energy and do it appropriately so that your conclusions are accurate and correct, and therefore your patient doesn't get sicker and deteriorate based on the fact that we didn't do our job, right? So just make sure that it's thorough, right? You must use valid data, sound reasoning skills, and again, never make assumptions. Just because you previously cared for somebody with these type of presenting symptoms, it may not end up being what it is, right? So definitely follow that path, right? That's what we do. We use our experience to help guide us with collecting more information or guiding our further assessments and things like that. But if it doesn't pan out and you're seeing further data doesn't support that, then let it go, right? Alfaro Laveri recognized the nurse's possible patient care concerns that can be addressed through nursing diagnoses, right? We need to recognize patient safety risks, identify what is impacting the patient's health and well-being, anticipate any complications that could arise from that, right? And primarily to prevent them, right? If we can anticipate something that could potentially go wrong, then we can prevent it from happening by making the environment safer or whatever that may look like. And initiate urgent interventions for any life-threatening condition. Another key aspect that nursing diagnoses need to address are to address potential problems or concerns. So we look at, when looking at potential problems or concerns, the step to doing this and the reasons behind it is listed on the slide. So please take a moment, pause, and read through them, right? It's very important. As a nurse, you have the knowledge base to know the risk factors and conditions that can lead to complications in your patient's health status, right? It's very valid information. An example is, say you have a patient who has severe impaired mobility. As a nurse, you know that this can cause many complications, right? Like skin breakdown, right? That leads to wounds that could potentially lead to infections, right? When there's a portal of entry for bacteria to get in the body, like with wounds, right? That can just deteriorate over time. Or impaired mobility could, they're maybe they're not in a wheelchair, but they're impaired in the sense that they're weaker, so they need a walker. So there's a risk for falls, right? Those kinds of things. You're making those determinations based on gathering all that pertinent data, right? Um, so it can help you narrow down what is your patient vulnerable for so we can prevent that from occurring. Um, and that way we do, and what we do is we take that information, right, that they're at risk for a pressure ulcer, right, due to immobility. We take that information and we formulate our nursing diagnoses for risk for impaired skin integrity, um, and we'll form our interventions around this to prevent that from occurring, right? We know that this is a risk. We're going to formulate our interventions and we're going to implement those, and hopefully the patient's skin will stay healed and 100% and keeping them safe. Um, and then also another one we might formulate with the same patient might be risk for an ineffective airway clearance, due to the fact that they're not moving around as much, right? And it will complicate those things, right? And then, of course, we will formulate interventions to prevent any, deterioration of, maybe getting pneumonia when fluid sits in the lungs and can't be coughed up. What better warm, dry environment for bacteria to grow in than in the lungs? You definitely don't want fluid in there. In the healthcare field, there are different types of diagnoses, right? We have nursing diagnoses deal with problems that nurses are trained to do and can do independently without a physician's intervention, right? Medical diagnoses deal with the patient's actual medical problems. Collaborative problems are where we work together to provide interventions. So maybe it's like a collaborative might be, you know, nursing interventions, formulated interventions, discipline interventions, right? So we're going to collaborate with PTOT, or we're going to collaborate with the physicians and all, so there's like a million different examples in your book. So please pause your book and look through those. And we're going to come up with some in class too. So know that, again, with practice, it'll get easier, right? This slide gives you a visual of what collaborative problems could arise based on a patient's medical diagnoses, right? Oh, yes. So, their treatments, maybe diagnostic interventions that we're going to be doing, right? Again, we're not going to be spending a ton of time in block one on collaborative problems, but we will be focusing somewhat, and we'll give you a good baseline to move into the later blocks, which of course they're going to delve way deeper into, right? But again, you'll get way more collaborative problems as you progress through the block, and they'll get more complex as you progress through the block. So for example, just to show one collaborative medical diagnosis situation, the patient gets diagnosed medically with ovarian cancer, and then the potential collaborative problem might be they're cachectic. Maybe so because of this ovarian cancer, they have wasting that occurs, right, and they become cachectic, right, and that brings on a whole slew of other problems that we need to address. So we're going to be collaborative and start to try to prevent any further deterioration with that patient's health status, right, and their safety. Here we are revisiting using clinical reasoning to formulate correct nursing diagnoses. You must be familiar with the nursing diagnoses and use reference materials as needed. A student in Block 1 years and years ago, I mean like over a decade ago, created this really cool handout that took all of the nursing diagnoses and put them under each body system. And so we're going to hand that out to you in lab either the first or second week. So you're going to need to become familiar with it. So use that reference, keep it handy, and utilize that. You also need to trust your experienced nurses, right? They've got a lot of knowledge in their brain and are able to really help you. So please reach out to them. Respect your institution, right, and follow their rules. And also, please keep an open mind. Again, don't be so committed to, whatever it is, your nursing diagnoses or whatever, that you overlook really what's going down with your patient. And these are some good question lists. There are some really good questions listed in your textbook under this heading of diagnosing. And I would recommend that you pause the video and take a look at those because, again, the nursing process is really going to be key to helping formulate your plan, your nursing plan of care. So interpretation and analysis. These are the steps in data interpretation and analysis. This is important so that you can come to correct conclusions and select the correct nursing diagnoses for your patient. First, you have to do is recognize what is normal for your patient, right? What's their normal and what is considered normal for most standard patients, right? Those may line up and they may not, right? But you need both. So after gathering that information, what's standard or normal baseline. Well, let me give you an example. I have a friend who's very thin and athletic, right? Her resting heart rate is about 50 beats per minute, and this is her normal heart rate. She's always around 50 beats per minute, and was established, let's say, upon admission during the admission interview, right? You definitely got to get all those things we talked about previously. I would not select a cardiac related nursing diagnoses for her, even though it's much lower than the standard heart rate, right? Because it's not a problem for her. That's where she lives. That's where she resides. She's not symptomatic. She's not having symptoms that are affecting her, right? So she's healthy, right? So you can look at the standards as to what is normal for a certain age, population, those things. But you also need to look at what's normal for the patient's baseline. Look at normal behavior responses, look at normal physiological functioning, all of those things, right, to establish a great baseline for your patient. Next, you need to group or cluster your data so that you can look at it and see if there's multiple clues that go together, suggesting there's some type of pattern, right? And that will help guide you, right? So I want you to go back to your textbook now. They show really good examples of how to collect cluster data and to help come up with conclusions. So take a moment and review that, right? It's very important. Next, determine the strengths of your patient and their family. Strengths can be included and should be included in their functioning ability, their cognitive ability, their maybe their coping skills, spiritual skills, support they have from their family and their friends and things like that, right? Point these strengths out to your patient as often as you can, because oftentimes when they're ill, they're not going to be focused on anything like that, right? When you're so ill and you're consumed and you feel awful, you're focused on those problems, right? So you need to be the voice of reason and you need to be the shining light and remind them about their strengths, right? That can help with their current problem. From there, determine the problems that need to be worked on and the potential problems that may arise in the future that need to be addressed as well. And then come to your conclusions. In the conclusion phase, the outcome can have one of four results. No problem exists. A possible problem may occur, or there's an actual problem, or there is a clinical problem outside of our scope within a nurse that requires interventions from other healthcare providers, right? So here are the different types of nursing diagnoses. So for a problem-focused nursing diagnoses, for example, for a pneumonia patient who is dyspneic or has shortness of breath, their SpO2 or oxygen saturation is less than 90% on room air, and you can hear a congested cough, right? So problem focus would be impaired gas exchange related to secretions in their airway as evidenced by or as manifested by. So AEB or AMB does not matter. They mean the same. As evidenced by dyspnea and SpO2 of 86% or oxygen saturation of 86%, right? And then we have risk nursing diagnoses. So for example, for a chemotherapy patient, we might have risk for nausea related to chemotherapy treatment, right? It's a real possible risk, right? And then finally, we have health promotion nursing diagnoses. So for a patient asking for more information about their disease that is new to them, and then our nursing diagnoses would be readiness for enhanced health management, right? That's what we want them to do. We want them to be asking those types of questions. So again, nursing diagnoses consist of different parts. We have the problem or the label. That's the first part of the diagnoses. This is chosen from a predetermined label that NANDA has established, right? And NANDA is a common language for nurses. So this part cannot be changed or modified, right? So NANDA is what it is. And this is so that it establishes the same language that we use in nursing across the country, right? Per se. And so that way we it helps guide our practice and helps improve patient outcomes as a result, right? So again, it cannot be changed. Your textbook has all the various possible nursing diagnoses labels available to you. So take a look at those. It's really, really helpful. See how they are listed as a descriptive of what is going on in the problem and not using the medical diagnoses. So when you're doing this, right, this will help start training your brain to be able to recognize a medical diagnosis versus a nursing diagnosis, right? Next part is the etiology or the cause of the problem. This is specific to your patient. Your references will guide you, may guide you with, a possible vague or let's say broader terms as a base. But then it's up to you, right, to narrow that down and put very specific etiology of your patient that's in front of you. So again, the reference that we use, NANDA, is to guide you toward creating a more specific etiology of what's happening with your patient, right? The third part of this is the defining characteristics or what we call the signs and symptoms that your patient's displaying or telling you that supports the labeling of or the problem of the nursing diagnoses. So again, components of a nursing diagnosis, we have the label, we talked about it, related to factor, the defining characteristics. So again, you want to label your nursing diagnoses as such. Label, problem. Impaired gas exchange, etiology. Related to restricted airways, right? That's the cause, the etiology. And then you're going to go by defining characteristics as manifested by or as evidenced by, and you just put the all caps, A and B, AEB, and put those defining characteristics, right? So in this example of impaired gas exchange, we're going to say the patient's dyspneic or dyspnea with use of accessory muscles and weaning, right? Those are all the defining characteristics. So love it, love it. This slide goes over the different types of nursing diagnoses and what they consist of. First, we will go over actual or problem-focused nursing diagnoses. This is when there's an actual problem that is present. The book says it has 4 components, or many resources out there. I shouldn't say just our book, but many resources out there say there's 4 components. But that really isn't accurate when you're writing it out, as there are only really 3 sections to it. The definition is something you look up to make sure you have the correct label. So make sure, because there are a lot of different definitions that par down as you narrow down within that definition. So just make sure you have the correct label, right? So now I'd like you to access your course point Lippincott resources. So you're going to pause the recording. Once I tell you about the directions, you'll write it down, pause the recording, and then access your Lippincott resources so you can see where this is located at, right? I'm going to highly, highly encourage you do this as you're going through the recording so that you become familiar with your electronic resources, because they have given you everything you need to become successful as a safe quality nurse, right? So you're going to go to your textbook. So you're going to go to your fundamental textbook, and you're going to access the Lippincott Advisor for Education. You're going to click on the Nursing Diagnostic Care Plans, click on the Acute Pain Care Plan. The first thing you will see in the definition, the first thing you will see is the definition of this diagnosis, right? And then you need to ask yourself, is that appropriate for what is occurring with the patient? Or do you need to seek further on down and select a slightly different one, right? See where it says related to? This is the etiology of the problem. Note how it is non-specific. This is where you can make it specific to your patient. So related to, abbreviated R/T, right? So you're not going to write out related to, you're going to write R/T. And then in the example, I have acute pain and then related to right knee surgery, right? So acute pain, R/T, right knee surgery. Next in Lippincott, it gives you possible signs and symptoms the patient might be displaying to support your choice of your nursing diagnosis, problem, or label. This is under evidenced by. We abbreviate as evidenced by or as manifested by as A, all caps, A and B or AEB. Remember, your reference material is listed very vague, right? So you need to customize it to what's happening with your patient in front of you, as I've done with this example. So our complete actual nursing diagnoses would be as follows. Acute pain related to right knee surgery as evidenced by patient reporting a pain level of 7 out of 10. Next, we are going to do a risk diagnosis. This only has two parts because the signs and symptoms obviously are not there, right? The defining characteristics, because it's not a current problem, it's just a suspected problem or a potential problem. So there's only two parts basically, right? So go back to the list of possible nursing diagnoses and click on R on the top, and it will take you to the risk diagnoses. Scroll down and select risk for infection. Under risk factors, it says alteration in skin integrity. This fits our patient, but it's too vague. So in the example, I will opt to customize it to reflect that it's the knee surgery, which requires an incision in the skin that results in impaired skin integrity, right? So you need to make that note. So that's very specific. Also note that your list, if under risk factors, the statement is in blue. That indicates that the term is also a nursing diagnosis label, right? So there are times when they will overlap and it will be both, and those will be in blue in your resources. So in block 1, we are going to focus on actual and risk diagnoses. Also, there are wellness diagnoses. Usually deal with healthy people or people desiring to get a higher level of knowledge or wellness, right? This is a one-part diagnostic statement. Again, we're not going to do these in block 1, but please, you do need to be aware of them and you need to know what's in them. So please go back to your list of nursing diagnoses under R. See all the ones that start out with readiness. So you're going to click on, let's say, readiness for enhanced comfort, and you will see these listed under defining characteristics. If this matches what is going on with your patient, then this just confirms this would be a good nursing diagnosis. And again, we're not going to go into syndrome diagnoses in block 1, but you're definitely going to cover it later in the block and other blocks. So be looking for that. Here's just a sample of a EHR care plan from one of the hospital charts. There are many errors that you can perform while writing nursing diagnoses, especially when you are first starting out. This is why we will practice this extensively this week and continue doing it throughout nursing school. You will eventually be able to formulate these easily using your knowledge base, references, and computer programs. The potential errors are listed here. Please pause the video and go into your textbook that also goes thoroughly into examples and how to carefully avoid these. Most of the time starting out, you forget not to try to customize the label, or you don't customize the etiology and leave it too vague, or you're mixing up this is a big one. You're mixing up defining characteristics with etiology, or you're using a medical diagnosis. That's another big one instead of a nursing diagnosis for the label or problem or etiology. Or you're only using two parts in an actual diagnosis, which has to have three parts, or you're using three parts in a risk diagnosis by including as evidence-based, as evidence by, and remember, it's risk. It's not happening, so there are no signs and symptoms, right? Now, don't worry, this takes time, and we will practice it extensively this week and well beyond. And I've told you, give yourself grace. It's going to take time to learn, and we're going to practice it enough where you will learn it. Trust me. Here's a slide listing the sources for error in nursing diagnoses. Take a moment and read through them. It goes back to not getting the right data or not having enough data, maybe not validating the data, or maybe you omitted too much data, right? So you really got to go back to that first, planning, gathering, and all that, and just start over, basically. After coming up with your list of nursing diagnoses, the last step is to take a moment and validate them. This list on this slide shows questions you can ask yourself to validate whether or not the diagnosis is appropriate, right? Take a moment, pause the video, and read through them. Now we need to do the documentation of the nursing diagnoses. This will be done by writing out your nursing care plan in Block 1 so that you can practice and erase and modify the documents as necessary. You will also be practicing using our electronic medical record in Block 1 called DocuCare all through the semester. When you come to simulations, you will be doing DocuCare plans in the system. This slide reviews all the advantages of using an electronic health record in regards to nursing diagnoses and patient care plans. Take a moment to pause and look through them. Okay, you may be feeling a little bit lost right now, but please don't worry. We are going to practice formulating nursing diagnoses extensively this week and in the upcoming weeks and in lab. So please, know you will get there. Just put the work in, okay? And this is the end of diagnosing.